My first example that drove it home to me, I had a guy come in and he'd had a bypass and he started to have chest pain again. And he walked 25 yards, he'd get chest pain. Previously, he was going for a 3-mile walk. We did a heart cath because we're still doing it back then. And it's like your bypass graft to the bottom of your heart's blocked off. We can't do a stent. But there's one thing I wondered if you'll try is this plant-based diet. In 3 weeks, he was back walking his 3 miles a day. Chest pain went away like immediately. And his whole family, the great thing about it, became plastic. You know, his daughters lost weight. They didn't have coronary artery disease this time, but everybody benefited from it.
Hey everybody, it's Chris, and today I'm interviewing Dr. Jami Dulaney. She's a plant-based cardiologist and primary care physician with a passion for cooking and endurance sports. She's actually an ultra runner, and she's 61 years old, and I am confident she can outrun me. Okay, I've never run an ultra race. I'm actually looking forward to talking to her about this because it just sounds like torture to me, but I'm so impressed by her. And she is a living testimony of not only how you can thrive in your 60s on a plant-based diet and compete at a very high level of athletics, but also as a physician, she is helping patients reverse chronic disease with diet and lifestyle. What a concept. Of course, if you've been following me for a while, you know she's not the first plant-based holistic medical doctor I've interviewed. She's one of many, and I love introducing these practitioners to you because, one, they're few and far between, although the numbers are growing, but two, these are my favorite people. These are the people that are on the front lines helping their patients actually heal, as opposed to just pumping them full of drugs, medicating their symptoms, and really not solving any problem, and actually sort of kicking the can down the road and creating more problems. So anyway, that's a bit of a long intro, but Dr. Delaney, thank you so much for taking the time. I'm excited to talk to you.
Finally, nice to speak with you. You and I have spoke on the phone a little bit over the years, and it's a pleasure to be on your podcast.
Yeah, I'm glad to have you, and this is going to be fun. I asked you before we started recording if you had any health challenges that prompted you to get into plant-based eating, and you said no. And so I'm curious, how did this happen? When did the shift happen in your life as a let's say, just conventionally trained physician to move away from just, hey, here's a pill for your ill, into let's dig into your life and make some changes and help you heal?
It actually happened in the cardiac catheterization laboratory. I was getting ready to scrub in to do a heart catheterization, and one of the technicians was there eating a giant bowl of salad. And I said, "What are you doing?" And she says, "Oh, I'm vegan." And it's like, "You're vegan?" I grew up in West Virginia, and there aren't very many vegans in West Virginia. And I was in Florida at the time. It was all new. She said, "Go read Diet for a New America by John Robbins." So I said, "I will." So I went home that weekend and I read it cover to cover, and I was astonished. I was astonished at the health benefits of being plant-based. I was astonished of the environmental aspects. I knew nothing of animal farming. So I declared to my family at the end of the book that we were all vegans. And my family said, "You're a vegan." We're not a vegan. So I went along on my own for a while, doing my thing and, eating what they ate. And I would eat my vegetables on the side and people would make fun of me. And I'm also a runner, as you said, and I was running marathons at the time. I was listening to a podcast, and I was listening to a podcast about a guy that lost a lot of weight. And he was being interviewed by another vegan. She's called Vegan Running Mom. And they were talking about this new documentary, Forks Over Knives. And it's like, geez, I wonder what that is. So I ran home and I downloaded the documentary, and it's like, that Dr. Esselstyn is the guy I want to be like. I've always had a practice that we pride ourselves in taking time to talk to patients and to explain why, as opposed to you just do something. And I've always been into physical fitness and trying to get my patients to exercise, but I was never quite sure how to implement it until I saw his study where he took the patients and put them on a plant-based diet. He educated them, he called them, He followed up with them and he had great success. So at that point, we started a class in the office in the evening where I would persuade somewhat sternly to some of my patients to come and take this class to learn how to eat plant-based. And I made them pay $25 so they would show up for 6 classes. So I would cook, and it was funny at the time, my mother said, "You're going to cook and talk at the same time? That's just going to be a disaster." And it's like, no, I'm going to show them how we do it, and we're going to do this. And it wasn't too long, probably 3 classes in, I was talking about diabetic neuropathy, and this guy, I could see, how somebody starts thinking and the light bulb is kind of coming on. He said, I haven't had any pain in my feet for like a couple weeks. And I started taking people, these people that were in the class, I started taking them off their blood pressure medicine, their cholesterol medicines. I mean, I was dialing things back. And we had a couple of really good success stories with people that were kind of end stage and that they came in and it's like, listen, I don't have anything more to offer you, but I got this way of eating. You want to give it a shot? And it was amazing, the turnaround. And, like a lot of people that you probably had on the show, once you kind of see the light, you can't go back. And so we evolved. We went from, 1 class to 2 classes to 3 classes to having an off-site place where we could have bigger classes until I'm actually sitting in my former stress lab that is now a kitchen. So we can have 25 people in a class now. I have a full kitchen, and we can, do demos, and that's how, and then the whole practice went that way. So it's the best thing I ever did in my life. Yeah, I have to say that I think it was about 2015 when we finally made the complete switch, that I've helped more people in that period of time than I did all the time being a traditional cardiologist. So
That's saying a lot.
It is.
That is really saying a lot.
I always prided myself being very good at titrating cholesterol medicine, diabetic medicines, blood pressure medicine. So we got the numbers just right, but the numbers being right didn't fix the people.
Okay, so when did you read Diet for a New America?
It was around, I'd say it was someplace around 2000, 2004 or something, someplace around in that area, and again, didn't have any idea. I went vegan, but I give people, and at that time I was giving people Dean Ornish's book. And I'd say, this is a good way to live if you can do it, but it's really hard. So that's kind of how we struggled for a while, or I struggled for a while. And then again.
That was the same. So it's interesting because if it was 2004, that's when I was dealing with cancer. So that the very same year is when I was trying to heal myself and had converted to a plant-based diet and was doing everything that I did. And I didn't know about John Robbins. I didn't meet him till years later. And I have interviewed him, and I'll put that link in the show notes because he's an incredible man. I mean, the ripple effect from his books is just massive. And he's really one of the pioneers of the plant-based movement. I mean, he published Diet for a New America back in the 80s. And he was, traveling and giving lectures and talking about eating a whole food plant-based diet when it was super fringe, right? It was not cool or hip. It was a fringe diet for sure. And I'm very thankful to John and the Sun Ocean too for all the good work they do. But okay, so and then you also mentioned Dr. Caldwell Esselstyn, who I've also interviewed. I'll link to him in the show notes. But yeah, he did this incredible study proving that you can reverse the progression of coronary artery disease, atherosclerosis, heart disease, right? With a plant-based diet. Like, his study is so wonderful, and it's real people. And I've read his book, How to Prevent and Reverse Heart Disease, and I recommend it to everybody I know who has high blood pressure or cholesterol. And so I'd love to ask you, in your practice, you said that you've helped more people since 2015 than you did leading up to that point, in several decades, I imagine. And so typically with cardiovascular disease, you don't see patients get better, right? You just try to stabilize them and just sort of keep their disease under control.
Right. We patch them up. You have a blockage, you're having chest pain, we put a stent in, we do a bypass, your chest pain goes away. If you have heart failure, your heart function is reduced, we give you diuretics to make the heart pump a little easier. So we make people do better with what they've got. Cardiac rehabilitation went a long way in the late 90s to help people. Before that, if you had a heart attack, they would say, go to bed. And you were a cardiac invalid at that point. And it was in the late 80s, early 90s that cardiac rehab took off, and we found you need to get patients up right away and have them moving. And we would, train people. You would put them in cardiac rehab, and you have them do a stress test right after their heart attack, low level, and then we'd actually train them for the final exam stress test. And so if we get people to exercise, that greatly improved their quality of life. But that wasn't easy. And even at that time, insurance and didn't want to really reimburse for even cardiac rehab. So doctors would typically say, go exercise and eat a healthy diet. Of course, I would say, go exercise and eat a healthy diet. And it would be, have a potato and a vegetable and a meat, don't eat junk food. That was the healthy diet that we all, really gave. It was never, eating a plant-based diet or certainly greens or anything. So things changed dramatically. And Dr. Esselstyn's study was remarkable in the fact that he had no adverse events. And that is really important because every study with a stent or a bypass or medication statin, they have adverse events. So even if you take somebody and you put them on a medication and you take their cholesterol down to 100, those studies still have people having events. So it doesn't, no matter, so that doesn't wipe everything out. So we know, just a number, your cholesterol is not in a vacuum as what causes disease progression. It's multifactorial. And unless we address all of those, which nutrition and exercise does, we're just patching people up for the time being.
So I'd like to dig into that cholesterol topic, because I think there's a general misconception or misinterpretation of the data that you referred to. And I'm going to try to articulate it the best I can here. But basically, because cholesterol lowering medications or interventions don't necessarily prevent future cardiac events or, cure heart disease or whatever, there is this pervasive idea that I see often of people saying, see, cholesterol doesn't matter, right? Your cholesterol levels don't matter because they lower it. If they lower it, and you can still have another heart attack or whatever, right? But of course, they're just talking about lowering it artificially with drugs and not lowering it in a way that is, sort of holistic and your body actually solving a problem, right?
Correct. So, if we lower your cholesterol, but then you eat a hot dog and you cause all this oxidation and all this inflammation in your system, your cholesterol, there's not that much cholesterol in a hot dog, but everything else that's in a hot dog goes to spur, and the cholesterol is almost fallout. Question, is it the primary factor, or is it something? When we see a plaque, there's definitely cholesterol in it. There's not a coronary artery plaque that doesn't have cholesterol, but it also has white blood cells and all kinds of debris. So you're right. If you let all the, if you let all the mud in, but you take out the sand, you still have a problem. And that's really where we see with cholesterol, medications. You might get a 1% drop, 2% drop, but that's about all you're going to get because we're not addressing the other factors.
Yeah, that's great. Patients are still eating so many other aggressive dietary factors, problematic, inflammatory, disease-promoting molecules from food. So what happens when you take a patient who has cardiovascular disease? They have high blood pressure, high cholesterol, right? All the markers of cardiovascular disease, and put them on a whole food plant-based diet.
It depends a little bit, the speed. You see these testimonies, 2 weeks later, I lowered my cholesterol 60 points and I'm off. If somebody was on a terrible diet and we fix a terrible diet, we can see some pretty big, quick adjustments. I've had people that were on a fast food diet, you drop everything just backs off right away. If you have, and typically I'm in Florida and my patient before changing my practice, but my average patient population would be 70s, 80s, let's say 65 to 85. Those people have been accumulating plaque and disease for a long time. And, not only is the coronaries and the blood flow to their kidneys and all, so they're multi-organ problems. So the first thing that we see is we take the salt out, and we start to see a lowering of their blood pressure. Their cardiac function improves. We take the high fat diet out. We give them some greens, especially. I have my first example that drove it home to me. I had a guy come in, he'd been my patient for a long time. We were in the beginning of doing this nutrition class, and he came in with his daughter, and he'd had a bypass, and he started to have chest pain again. And he walked 25 yards, he'd get chest pain. Previously, he was going for 3-mile walks, but now, things have backed down that, and I was like, well, we did a heart cath because we're still doing it back then. And it's like your bypass graft to the bottom of your heart's blocked off. We can't do a stent. But there's one thing I wondered if you'll try is this plant-based diet. And I told him about, we want you to get 6 cups of greens in the day, and we want you to get rid of the animal, blah, 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 the whole 9 yards. And his daughter was there, and she said, I'll cook for him. We'll do this. The guy, in 3 weeks, he was back walking his 3 miles a day. Chest pain went away like immediately. And his whole family, the great thing about it, became class, his daughters lost weight. They didn't have coronary artery disease this time, but everybody benefited from it. So, if we can get people to be on board and have support, then things turn around pretty quickly. The problem, as is once we turn things around with cardiovascular disease, because everybody knows somebody has had a bypass or a stent, and they're walking around, they're fine. It's not quite as scary as cancer. People that die that have had cancer, but, a lot of people do okay with coronary artery disease. So they start feeling better, and guess what happens? Things start slipping in. Thanksgiving comes along, Christmas comes along, and so then we have to reset. But, it's been amazing to me, to see the progress at, again, this guy's in his 80s. Another man in his 80s came in literally with a walker and an oxygen tank, swollen legs like stovepipes. And he came in with a caregiver. And, he was in a mess. And I said, would you try, have you ever talked about the rice diet?
I have. I'm very familiar with the rice diet.
Right.
Yeah,
So
Dr. Kempner.
Yes. Yeah. So this guy was really in bad shape. And I said, listen, I said, could you try for 1 week for me something really radical? I said, do you think you could eat white rice and steamed vegetables, and you can have fruit for breakfast for 1 week, and let's see what happens? His primary care called me on Thursday and said, what have you done? This man, his blood pressure's low. We're having to take him off his diuretics. He's dropped 10 pounds of water. When the guy came, we took 40 pounds off of him in like 3 weeks, most of which was water. He came in, he was walking without his walker. We got rid of his oxygen. His anemia improved. He was happy as a clam. And he said, I'm a runner. And he said, I think I might want to run. And I said, let's just have you walk steady first, but he did very well. Story didn't end well. He did well for 2 or 3 years. His healthcare provider or assistant left him. His kids put he and his wife in a assisted living facility where he couldn't get a plant-based diet. Things came back. But, it's amazing at his age to see the remarkable change. And he was a Vietnam vet. And he said, I don't mind white rice. He said, I've eaten a lot of it. But it really doesn't matter what age it is. People can still get a benefit. And that's really important.
Rice has gotten a really bad rap. It's been demonized because it's white. People think if it's white, then it's the same thing as white sugar. They think white potatoes are evil, white rice is evil. I'm surprised they don't think cauliflower is evil, but somehow cauliflower is a white food that is permissible by some health and wellness gurus. But anyway, for those of you who don't know, Dr. Walter Kempner was at Duke University for 40 years, and he treated some very, very sick patients, advanced kidney disease, massive obesity, diabetes, all kinds of chronic health problems. And he had a live-in program, and basically, helps people heal, putting them on a diet that was mostly white rice and fruit And in some cases, it was only rice and fruit and no vegetables. And so he busted the myth. Unfortunately, the myth still exists, right? But his own work, if anyone wants to dig into it, his own clinical work is a complete myth buster as to the this idea that carbohydrates, that fruit and rice are harmful to you. They're not. They're wonderful health promoting foods. And so I love that. I love that you know Dr. Kempner's work and that you helped your patients with that information.
It's been a game changer to get people started, especially when people are really sick. So if you can just right away, you give them, eat fruit. I don't care how much, steamed vegetables, get your greens in, but steamed vegetables. You like carrots, you like cabbage, because you have to meet people where they are. And especially older people, we're talking a dramatic lifestyle change. If you're
Sure.
75 years old, and you've been eating a certain way all your life, it's a little bit radical to say. But if you can find, do you like I can always find something people like, and can you do these 3 things for me? And we'll just see where it happens. And they feel better, so that they want to continue.
Yeah, simple plan, right? It's got to be simple, easy to start, and sustainable. Not, it's obviously it's restrictive, right, in some ways, right? Let's stop eating meat and cheese and eggs, right, and animal products and processed food and junk food, like, right? But let's figure out all the vegetables you like and focus on those, and all the fruit you like and focus on those, and the good whole food carbohydrates you like. Eat as much of those as you want. Yeah, I love your approach. I think it's wonderful. And thank you for answering my question earlier. And I think that is a great point you made about the fact that different people respond differently to the diet and lifestyle intervention, and people in really bad shape tend to respond really quickly in some ways, but then really you've got to be in it for the long haul, because you get, and I'd love to hear your clinical perspective on this. At what length of time, if we can use an average, what length of time would you say you see the sort of the maximum benefit, where it's sort of it levels off and they've accomplished this massive goal? I know it varies from person to person, but is it 6 months, 1 year, 2 years? If they're really following your program.
It's really in 6 months, we make a tremendous amount of progress. And again, depends, so we have people that are on 100 units of insulin and so the way we do it, accountability is key. So if somebody is on insulin, because, if you change your diet, all of a sudden your sugars can get down pretty quick. So I actually have them check their glucose before they go to bed and first thing in the morning, and have them text me every day. They text me in the morning every day with those 2 numbers, and we decrease their insulin accordingly of how their day went. And we use it not as a punishment, but okay, so let's see if your glucose went up. What did you have that drove it? So people start to understand, if I did this, it resulted in this, because people don't realize just how much oil or fat in the diet can drive glucose. And they'll go back and they'll say, you know how the diet history goes. They didn't have anything, salad, blah, blah, blah. But when they'll find something, and it's like, okay, so if you take this out, then all of a sudden we have a response. And it's not, I tell people it's not a straight arrow curve into perfection. It's up and down. But we'll see people go along with their glucose, and then they'll have a really good improvement. They'll go along, then they'll have a big improvement, and they'll go along. And we finally wean them all the way off of their insulin. Sometimes we'll get down to 2 or 3 units, and it comes down, and even maybe we might normalize their body mass index, but we have to actually change their body composition, because as people get older, they lose muscle mass and bone mass if they haven't been lifetime exercisers. So even though they may get down to their high school weight, they're not down to their muscle mass. It's not that. So the mitochondrial function is not that. So then that's when we start focusing. And we actually do a mobility class. We have a yoga class. We have strength training, flowness, and wellness challenges. So we try to change their body composition so we get a little bit more muscle. And you can do that at any age. And so as we change their body composition, that's the last step to getting rid of those 2 or 3 units of insulin sometimes, especially if they come from 100, something really big. And I don't know how much you've dealt with diabetes, but when you if you have high insulin levels because you have diabetes, it drives your hunger. The people are always hungry. But if you're taking a lot of insulin, you're always hungry as well. So the more insulin, so people's glucose goes up, they get more insulin, they get more hungry, their glucose. So it's a vicious cycle to have to break. And so if we can keep people accountable with us, we can bring it right down. I mean, there hasn't been one adult onset diabetic that I have not been able to bring their insulin down.
If they follow your directions.
They follow direction. And we always laugh, sometimes, I get ghosted, and it's like, so I'll text them. It's like, I haven't heard from so-and-so. It's like, hey, where are you? It's like, oh, I went on vacation. It's like, no, we've got to, keep going here. So it is, Dr. Esselstyn's right. You got to hound people a little bit to get them over the hump. And then the other education piece comes in, how do you deal with your friends and family? How do you live in the real world? Because that's very difficult. Again, I'm in Florida where people retire and it's all about going out to dinner, socializing. And how do you do that and have a life?
What's your pitch to somebody? Are you saying something like, give me 30 days, right? Just give me 30 days and follow this, just commit to this for 30 days and let's look at your blood and see what happens. Do you have that kind of a conversation, or how does it go?
Well, so early on, before we changed the practice, it was all comers. So typically as a cardiologist, somebody would have an abnormal stress test or somebody would have chest pain and they'd send it to me for a consultation. And I would have to give the 40 minutes of a plant-based diet reason, as fast as I can, and blurb all that out. I'd be hoarse by the end of the day. If I had 4 new patients, I did it 4 times. It's exhausting. And, you'd have the spouse in there kind of growling because, he's sick and I'm not sick. Why do I have to change, and all that. But when I changed the practice, we started like if you want to get off your medication, if you want to take control of your own health and do this. So I started getting people that were interested. And so that made it a lot easier because now people just needed to know the how and a little bit more of the why, and enough of the why so that they could defend themselves, so to speak. And it became, so it's like, let's start and just work with us and let us help you to navigate this, because a lot of people just don't know. You're used to eating a certain way, exposed. They just have no idea what's in food.
Yeah. And, that's great. You're right. It's so much easier to help people that understand what you're doing and want your help, even if they don't fully understand. They have some sense and they're open. Versus trying to twist someone's arm and talk them into it. But having said that, it is still difficult, right? It's still difficult to change your diet in a big way. And those benchmarks are really important, blood work improvement, things like that, for a person to see, the real results of their actions. So how do you typically monitor monthly or something for somebody when they start?
Again, the glucose, because we can have monitors, we do daily. So they see that getting better. We follow people, and I have a full-time plant-based registered dietitian. So we tag team them. I call, so I talk to them one week, next week she does, the first 6-8 weeks, we really tag team people every other week. And plus we have the nutrition class. So they kind of get inundated into the process. Through that, people are able to make changes in the education part of it, so that they can start to see, this is, and we don't tell them what to eat, but we start to give them, these are options for breakfast. These are options that, this is what we want to see on your plate. How do we make your plate look better for you? And then we check their cholesterol, usually, especially if we're trying to get them off. They're trying to get them off blood pressure pills. Again, we're seeing them more frequently, so we get them off pretty quick. Or water pills. We have to, because they start to drop their blood pressure. The same way with the insulin. Their cholesterol, we usually say, okay, let's 3 months, see where you are. If they're really ill, we may let them be on their cholesterol so they have a big drop. It's like, okay, now we're going to cut it in half, see where you are, keep the carrot going, so to speak, in 3 months. Because again, we know the statins increase your risk of diabetes by 4%. Depending on which statin, you might increase your dementia. So our goal right up front is to say, we want to get you off of this, but we want to do it safely. Same way with blood pressure medicine. Some of them are rebounds, so we just can't cold turkey, but we have to keep people accountable as they're going. So that's the benchmark. Of course, their weight, the body mass index, how long they can walk, getting them involved. And they typically feel so much better. You know what I mean? That is really a driver. The sad part is that they go back to their primary, or they go back to another consulting physician or another physician, and nobody ever says, wow, you look good. Wow, you better take your statins. Well, my cholesterol is 160. Well, you better take your statin. You need that diet. But my glucose, my hemoglobin A1C is now 5.6. Well, you still, they don't want to supplement that. And they will not pat them on the back for how well they look. It is so sad.
It is so sad. It's so frustrating, but we just laugh about it because we see this all the time in the cancer community where a patient, they radically change their diet. They're overdosing on fruits and vegetables. They go back for an appointment and their blood work looks amazing. Their scans have improved. There's, maybe no tumor growth, or the tumors have started shrinking, or some have disappeared, like really great stuff. And, they will just get the most just milquetoast response from the doctor. And usually it's like, well, yeah, everything looks good. Just keep doing what you're doing.
Yes.
There's no like, what are you doing? Tell me more. It's like,
I've had an oncologist tell patients, well, I'm glad you can do it, but I don't like broccoli, and it's like, I walk in the hospital, I usually go in, depending on what time of day it is, I might walk in through the ER and go through, and the first thing you hit are the vending machines. You smell the terrible foul smell of Subway sandwiches coming from the cafeteria. It's just all over the place.
Do you understand this mentality? I mean, was that ever your mentality early in your career where maybe you'd felt just overloaded or overwhelmed by the amount of work you had to do and the patients you had to care for, and you just weren't open to learning anything new? Or have you always been trying to learn more?
I always laugh. I never read a fiction book until the 90s. So I was out in my career before I ever picked up, and then it was historical fiction. So I never felt like I had time to read something for fun. There was so much to learn. I always have felt that. And I've always wanted to know the why. And so when we look at things like high blood pressure, I mean, we call it essential hypertension. It's not essential. It's not essential that you get high blood pressure when you turn 40, but we act like it's just something normal, and it's like you have, and when I tell people, it's like, well, you have high blood pressure, you have vascular disease. And they sit back and it's like, well, you got to have vascular disease. You got to have something going on to make this. You weren't born with it. You weren't born with a cholesterol 250. Most people, I mean, there's a few familial things, and even those people respond, so there's really very, very few people that, have the true familial hyperlipidemia that we can't do much about. And even those people, and I have some of those people, even those people that we don't move that cholesterol mark do fantastic eating a plant-based diet, because like Dr. Esselstyn has said, you can have the machine gun in the closet, but if you don't have any ammunition, it's not going to fire. And if we don't oxidize this cholesterol, and we don't have a lot of inflammation on the board, people do okay. So it's
some
just...
of these, I'm so glad you brought this up because it was in my, mental notes that I was hoping we would get there with the familial high cholesterol cases. Do you see them get under 200?
Sometimes
total cholesterol? Sometimes no.
No, I've seen triglycerides go from 2,000 to 130.
That's
which
phenomenal.
Is, still eating fruit. I've seen cholesterols drop into the 220s on people that were 300s, but not, a lot. But some people just never see the 150 mark. But but those aren't the people that are getting heart caths, stents, and bypass. So those aren't the people. The people that are having problems are not. They're the people with a cholesterol of 200, 220. That are eating a standard American diet that's full of inflammation. Those are the people that we see, because you hear it all the time. It's like, well, I don't, it was family history because, his cholesterol wasn't that high and he had a heart attack. So there. And, the doctor put him on statins, but it wasn't because of that. It's family history. I have to share one story with you in that my family history. Because if this doesn't drive it home, nothing will. My grandmother on my mother's side died at age 57 of heart disease and diabetes. My grandfather, her husband, died at 48 of a massive heart attack. My mother, their daughter, had 3 siblings, 3 brothers. They died in their 60s of heart disease and diabetes. My mother lived to 90, and she passed away a couple of months ago, and I had to cancel her tea time the next day. So she, and really story goes, she ended up getting a lymphoma in her 80s, had chemo, and probably had a cardiomyopathy because of that, but did quite well, golfed, yoga, Zumba, until the day she died. So a very full life compared to her family's. So if that wasn't familial coronary artery disease, I don't know what was as far as her brothers and her. My mother had high blood pressure and high cholesterol from the time she was 30 years old. She was on statins until we all changed. And she changed actually when she got lymphoma. She went plant-based. But the other brothers, my cousins, their children, stents, high blood pressure, diabetes. So the family history is there. The other interesting piece of the puzzle is GERD. People say they have GERD, and it's just something that happens to older people. It drives me crazy when I see those ads on TV that you can eat the pizza now that you're taking that proton pump inhibitors. So my mother had GERD until she was, started in her 30s. And I remember as a kid, my Lanta, Malox, Tums, and then, a Pepcid, and then the purple pill came along. Guess what happened? When I turned 40, even though I was vegan at the time, I had indigestion because I was doing junk food vegan at first, having the processed food, still having oil. I wasn't junk food so much, but I was still using oils. Got indigestion on the purple pill. I was like, man, this really ticks me off. I don't want to have to take the purple pill. So again, Dr. Esselstyn comes along, no oil, and it's like, okay, I'm stopping the oil. Guess what? My indigestion went away. I had to wean myself off the stinking purple pill. So my mom's 80 at the time. She says, I don't want to take the purple pill anymore. And it's like, well, you got to give up your olive oil. You got to give up your oils, And she says, oh, I don't use that much. I said, well, do what you want. But that's how I got rid of it. She gave up oils, seed oils and whatever. No more indigestion. So at 80, after all those years, off the proton pump inhibitor. So we know that it's inflammatory for a lot of people. And I haven't had anybody walk into my office. That's the easiest thing to cure. They say they have indigestion. It's like, I can fix that right now. And they are amazed.
Great. I love it.
They're amazed because they'll say, I can't eat peppers. I can't eat this. I can't eat spicy. I can't eat this. And it's like, oh, yes, you can. You just can't douse them with, peanut oil.
This is going to help a lot of people. I'm excited because I think that's a connection a lot of folks haven't made. It's something maybe they haven't tried yet. So what are some of the blood markers that you look at that are really important? And I want to use the sort of the high cholesterol person as an example. Somebody with a high familial cholesterol, but they're doing everything right. They're following your program. What are the other markers besides cholesterol that are red flags to you that are indicators of, okay, there's problems brewing?
We look at a C-reactive protein, so a sign of overall inflammation. That's one of the things that we focus on. ApoB is a kind of a accumulation of non-HDL cholesterol that can be, it's basically all the bad cholesterol properties kind of put together. So if the ApoB is high, we know that, those people, but the C-reactive protein, sometimes homocysteine, even uric acid can be elevated in people. But we get them, and then we correct them, and usually we go on. So, I always tell people I don't just test people to run a bunch of numbers, and I'm not going to treat just a bunch of numbers. The idea is to get you eating the best that you can, and we go on and let that be our guide for the most part, because I do believe that we get too focused on some of these numbers that we often miss other things, or makes people so focused. So it's usually not an issue. We treat the numbers, but I'm not going to do a bunch of tests to see what if, because I'm going to say, what am I going to do with the answer to the test? I'm going to tell you, you need to eat a whole food plant-based diet. So if you're, whatever mark you need, I'm never going to tell somebody, oh man, you know what? You have really good numbers. You can eat what you want. And when people, their spouse tells me, it's like, well, I don't have any problems with my heart. And it's like, I'm looking over and they're 30 pounds overweight. And it's like, and I don't have any cancer. And it's like, yet. So it's great that you don't, but it may be because we haven't looked or you haven't had any symptoms yet, but it's not going to hurt you too. There's no side effects to this.
Everybody thinks they're healthy, right? Until disease comes, and then they still say, "But I was healthy."
I never saw it coming. I never saw. He was healthy until yesterday. And just it's like no. And I, I mean, how it goes. You look at people, and he's like, how could they think they're healthy? I mean, how could you look in the mirror and see health there? I mean, their color's awful, their legs are swollen. I mean, I tease with we do a mobility class on Mondays. It helps with balance, but general mobility and posture. And, we look at alignment and things like that. And I was like, when you go to the grocery store, I said, look how people, you're standing in line. Look how people are standing. See how you can stand, and I always, joke with people. And it's like, yeah, I go to the grocery store. I look at people's legs, see they're swollen. I like make a diagnosis on aisle number 3, aisle number 4. You can go just down the line, and you'd like to say, you need to put that back.
Right.
Actually had give people a T-shirt that have the practice name on it, and one of my patients was in Sam's Club, like Costco, and he saw another patient he saw had his cart full of bad things, and he says, your doctor. You said you're Dr. Delaney's patient. He said, you got to put that stuff back. Let me help you. And
busted.
He actually took him around and helped him find food that like alternatives. And the guy came in, and he's like, I got busted. And
that was a divine appointment.
Yeah.
That's great. That was a guardian angel that showed up to get him back on the right path. Okay, so I want to switch gears. I want to ask you about ultra running. And you are, Dr. Delaney, you are 61 years old. You are an ultra runner. You eat a plant-based diet. How do you do this? What are the kind of races you run? And I'd love to know what your diet looks like on a daily basis and how you eat if you're preparing for a race or you're training really hard.
Well, for starters, I've done marathons, full Ironmans, and I switched over. We started doing more ultras here in the last few years. And this weekend, I'll be competing in a 100-mile trail race in Florida. It'll be my first 100-mile race. I've completed 4 50-mile races, including the Silver Rush 50 in Colorado at altitude of 12,000 feet.
Wow.
I qualified for their 100-mile race this summer, so I'll actually be doing a 50-mile race in Colorado and then going back out the next month to do their 100-mile race. So I've got some miles on me. I did marathons before I was plant-based, and I would hobble along and be sore for a week or so after. I remember the old days, he used to say, if you run 26 miles, you're going to need 26 days to recover. Now, if I run a marathon, I can run the next day. I might not run the next day. I'll travel, but the next day I'm out back at it. So the recovery is amazing. 50 miles feels like 25 miles used to. And so the recovery is huge as far as that go. And I attribute it to, and one of my best recovery meals is fruit. And I stumbled on that. Actually, we did a race in California, and they had breakfast after the marathon. And of course, they had breakfast with sausage and eggs and all this other kind of stuff. And the only thing they had that I was interested in was this giant fruit bowl. And so we just sat there and ate fruit while we talked to everybody. And I recovered I was so recovered so quick, hydrating, get those glycogen stores back. And so that's become a go-to after long runs. And, I'm always doing either a fruit smoothie or a fruit vegetable smoothie, a big bowl of fruit, after a long training run. Leading up, I eat the same thing. I'll eat spicy Thai food the night before, you know what I mean? Or what if we're traveling, I'm vegetables, rice. Like I said, I'm not afraid of spice. I'm not afraid of fiber. I took a bunch of friends to a raw vegan restaurant before a marathon, and I ran the marathon fine. They were all in the bathroom the next day. But, so I'll have a giant salad. I love to have a big kale salad. I mean, getting the greens in, how better to get all that nitric oxide. We sometimes eat beets before, certainly beets the night before. And, people will look at me, if you're in a restaurant where there's people that are, traveling, doing the race too, and, they may have an armband and they'll look at my plate, as they go by and they say, can you eat that before you go, all that fiber before you go run a race? And it's like, yeah, it's like, what a better way, to get everything cleared out the next morning to run. So I don't really eat anything different. I'm Italian and Irish. And so, my mom was Italian. So we ate pasta with sauce. I don't eat quite so much pasta anymore. I've kind of more rice. It seems to digest a little quicker. So I'm more on vegetables. My grain of choice would probably be more rice or quinoa these days. But I'll, if we're someplace, I'll do that. Potatoes are fine. This weekend, I'm going to have potatoes on it's out in the middle of nowhere. So I'm going to boil potatoes. We're going to have, fruit. One of my crew is going to do some juicing for me. So I've got juices. So in between, so that's kind of the fare that I'll be, living on. So it works out good. You digest, quickly. There are some ultras. I have a podcast and I'm trying to there's a ultra in Georgia that the race directors are vegans. So they have vegan options on their race course aid stations, but they're not a lot. So we typically prepare have our own food and drop eggs and things like that. But there's more and more, but it is very disheartening to see people training to do these things and then they eat such junk food, because you're burning a lot. You can get away with early on perhaps eating, but it kind of catches up with people. So, I don't have any arthritis, I don't have any joint pains, I don't take any medications, recover well, I sleep well, there's not, again, it's funny, it's not that many people in my age group, because especially the longer you get, it's like, it was funny because I qualified for this 100-mile race. I just had to win my age group, and it's like, well, it wasn't that much competition. Most of them were home on the couch, so.
Right. I mean, that's just amazing. Now, do you try to eat more because you're burning so many calories? Are you trying to kind of double down on your portions?
I eat to hunger. Like I said, I typically eat a big bowl of fruit for breakfast. I have chia seeds with that. Sometimes I'll put a little soy milk on it to kind of make the chia seeds soak up so they don't stick in your teeth quite so bad. I might have I make my own sourdough bread, so I may have some sourdough bread. Lunch is typically a big salad with, I have a variety. So I have my sushi type salad with rice and edamame and carrots and peppers and whatever. And, or I have more of a Mexican variety with, beans and then dinner is just, vegetables and, potato or rice, tofu, beans, it's just a regular fare till I'm hungry. And then I do have dessert. I will say my favorite dessert is frozen bananas, frozen blueberries, and some cacao powder and soy milk. I sit there and you have my own little soft serve party and I'm happy.
I love it. Sounds amazing. Everything you eat, I would enjoy. How long does a 50-mile race take? And how long do you think this 100-miler is going to take?
50-mile. So obviously they're all different in whether they're flat or mountainous. When we're at your 12,000 feet, it slows you down. That one took me, I think that one took me 13 and a half hours or so, 12 to 13 hours for 50 miles. I am hoping that this flat ultra will be somewhere around 26 hours. So I get my first chance to run through the night. Hopefully I'll see the alligators before they see me. And, and then when we go mountainous, it will obviously take more. So that takes a little adjustment. It's a hydration thing. The reason why I like the ultras, it's a bit of a science experiment. And it's a bit of, the old adage is you can do more than you think you can. And our bodies always have a little bit more. We don't use half our brain power. We don't use half our physical power. But I also like the science of giving my body nutrients and watching it go. So the way, so figuring out fueling and hydration is a little bit of a, science experiment for the day, depending on, the conditions and such. But I think that that's really, yeah, I want to see I'm an experiment of one. I want to see what my body will do for as long as it can. I enjoy being outside. I think there's nothing better for your mental state than being outside, being with others. The ultra community is ultra positive. People are cheering for strangers and helping each other. I mean, that's just a wonderful community for longevity in itself. I would like to make an impact on that, let, the younger people know if you eat a little bit better, you might last a little longer. But I think it's, I've always wanted to set a good example. I'm never going to tell my patients, you eat plant-based and I'm going to sneak out back and eat a steak. And I tell my patients that, if your doctor's fat, then you need to find another doctor, really. If your doctor doesn't look healthy, how's he going to help you? How's she going to help you? So I think it's very important. You have to walk the walk. And so I do that with the exercise as well. Maybe it's a little excessive, but, to date, things seem to be going good. And there's always a funny story to tell. Something will happen. There'll be a funny story.
Something crazy is going to happen if you're running
Exactly.
for 12 hours straight.
Yeah.
Oh my gosh, I cannot. I mean, I exercise a lot. I'm more of a CrossFit guy, so I do, shorter, intense spurts of maximum effort. But yeah, the suffering, the hours and hours of suffering, and maybe it isn't suffering to you, but it would be suffering for me because I know I'm not conditioned for it. But I'm in awe. I really am in awe of you and that you're able to do that. And I'm so impressed. You are living proof that a person can thrive on a plant-based diet, that, you can run 50-mile races. Haven't run the 100-miler yet. So we'll say, hopefully you can run 100-mile races, but run 50-mile races, eating a whole food plant-based diet at 61 years old. I mean, there's really no excuse. And this is what's so great about what's happening in our world and being able to share information and share our stories and all that with technology is like all of these pervasive myths and paradigms are being shattered because people just believe they need to eat animal protein to be healthy, fit, and strong. It's like, look at Dr. Delaney running 50-mile races, not eating animal protein. Where does she get her protein? From fruits and vegetables. Like, it's in there. Like, so it's like,
I've fallen down, nothing breaks.
Yeah. It's, so you're a shining example and I love it. And I just thank you for your time. This has been really fun. And I'm excited to put it out there in the world. Let's make sure that people know how they can connect with you.
My website is drdelaney.com. That's spelled out DOCTORDULANEY. Social media, it's Jamila Dulaney. It's JAIMELA. That was my mother's maiden name, or made up name for me. Half a James, half a Pamela. So it's a little complicated. It's Jamila Dulaney. And I do a podcast, Jami Dulaney Plant-Based Wellness Podcast. So I talk about my running adventures and have people like you on. You've been on my podcast, but a lot of times I just talk to the cat about different studies that have come out and try to review the literature and encourage people and share things that have happened in the office of regular people and how regular people do, so that, I think a lot of people think they're struggling alone and it's just them, but everybody struggles and it's okay.
I think that's awesome. I'm going to make sure and link to all of your resources in the show notes. So folks on YouTube, check the description. On Instagram, if you're watching a clip or whatever, or on chrisbeatcancer.com. We'll make sure you can connect with Dr. Delaney, and you are located in Florida. You do see real patients.
Every day, patients, and we have an online practice as well. So we see people actually all over the country, talk to them. So we do Zoom, and all our mobility classes and things and the nutrition classes and lectures are also on Zoom. So for people that don't live locally, they can get to them that way. So
it's fantastic. Well, Dr. Delaney, thank you again. Like I said, I'm just so impressed by you and I love what you're doing. And you've inspired me to maybe try to run a little longer than I like to run. Actually, last question I wanted to ask, how many miles do you run per day on average?
usually training at about 7 miles during the day, and then my long runs will go 20 miles on the weekends, 20 miles on the Saturday, maybe 10, 12 on Sunday. So when I'm building up 60, 70 miles to try to get, I have two German Shepherds that I run with, so they're inspiring because they both need to get their energy taken out. So usually in the morning during the week, one goes out with me for 3.5 miles, and I come back, switch dogs, and take the other ones out. So it's kind of a funny. I'm that person in the neighborhood that everybody knows.
Always running. I've got a dog that needs exercise too. That's more of a motivator for me than my own endurance for long runs. But this has been really fun. Again, thank you so much. Thanks for watching, everybody. And please share this video with people you care about. The world needs to know, your friends and family need to know that chronic diseases like heart disease and diabetes and cancer can be reversed. They can be healed with diet and lifestyle, and that fruits and vegetables and whole grains and starches like potatoes and beans and corn and rice are actually health promoting foods. They're good for you. So I think when they see this interview with Dr. Delaney, it'll really, a switch is going to flip, right? Because you got no excuse, right? You can't make any excuses. There's a 61-year-old woman running 50-mile races on a plant-based diet. Like, you have no excuse. So anyway, thanks for watching, everybody. Have a good one. I'll see you on the next one.